ReSPECT is a process whereby we can facilitate conversations with patients so we can better understand their wishes should they become ill and not being able to express those wishes as clearly as they would like to at the time.
I'm delighted to be able to talk about the ReSPECT initiative. What a fantastic word ReSPECT is. It really says what we're trying to achieve for patients. It does stand for the recommended summary plan for emergency care and treatment, and I always have to remind myself exactly what the acronym is. But I think it's helpful to remember that it is a summary plan for emergency care and treatment. So it's about emergency situations and it's about treatments.
So the reason we're moving away from the current DNA CPR form is that we feel this is an advance to improve patient care and improve our communications with patients. So in the simplest sense, the ReSPECT form is another form of DNA CPR, but it's much more than that. And I think if we think of it as just another DNA CPR form, we're missing a big opportunity.
The other really fantastic thing about this opportunity is that it is a real nudge to us to think about whether this person that is in front of us is at risk of deteriorating and dying and may face some key decisions about their treatment in the foreseeable future.
We know we can be doing this better, and this is an opportunity to do that. So as the acronym suggests, this is a summary document which can point to other sources of information such as advanced care plans, advanced decisions to refuse treatment, the fact that the patient may have a lasting power of attorney for health, and it can also point to other people who they would like involved in these discussions if they can't have the discussions themselves. At the end of the day, it's helping doctors make best interest decisions on behalf of the patient should that become necessary.
One of the really fantastic things about this initiative is that it is going to be a systems-wide approach. So whatever organisation we work in across Leicester, Leicestershire and Rutland, we're all going to share the same approach to discussing with patients what their choices are, recording those and sharing that information with each other. So whether that's an independent hospice like LOROS or the ambulance service or the UHL or indeed at home and the community services.
So in terms of when we want to go live with this, we're aiming for January 2020. And in practical terms, we've come up with a digital version of the form which will hopefully be ready to go live around about that time. So there's a digital version of this available in System 1. UHL are working on a digital version which should be available in the first half of this year. So for example, if a ReSPECT form was started in UHL, we have the ability as part of the discharge process to communicate that to general practice that a form exists, and very soon we'll be able to actually send the details of that form as well as the patient having their own hard copy.
There are some key things that the ReSPECT form encourages us to try and discuss with patients in advance of those situations arising, because they're so critical for the healthcare team to know what actions to take in those situations. And the very key one is the decision as to whether to offer resuscitation or not. And it's great that that's part of the discussion, but obviously the discussion about weighing up the burdens and benefits of treatment is much broader than just about resuscitation. We need to regard the ReSPECT process as a process. So the right time is more staged, really. And the most important value of these types of conversations, I think, in my experience, is to allow the person to have had those warning shots about this is coming, you might need to think about it.
The current DNA CPR forms remain valid until they are changed, and the idea is that if a patient, for example, does change healthcare setting after January 2020, that the decision about DNA CPR will be reviewed and then recorded on the new form. The intention is not to suddenly cancel all the existing DNA CPR forms and have to replace them all with a ReSPECT documentation. It's a gradual process, and there will be an overlap when we've got both sets of forms in use, and it's just about clarifying which one is valid, and the existing ones remain valid until changed. The ReSPECT form is a summary form. It will indicate if an advanced care plan with much more detail exists. So in that sense, both of these pieces of documentation are complementary.
There is a lot of training available online from the ReSPECT organisation itself, and that's really valuable and very pragmatic, and has some completed examples of what good may look like in a form.